So we will now move on to item 6.5, presentation of proclamation honoring Public Health Week, April 4th through 10th, 2022. And we'll invite our Health Director, Jonathan Portney, up as well.
I guess Jonathan didn't know he was supposed to bring a big crowd of people with him.
They're on Zoom.
They're on Zoom.
Yeah.
Where's our crowd?
They're working hard.
Working hard. There you go. Well, Jonathan, I know this is the first one you've joined us for, and thank you very much. So I'll go ahead and read it. This one is very long, so it's going to take me a minute. Board of Supervisors, County of Lake, State of California, proclamation designating Public Health Week, April 4th through 10th, 2022. Whereas the week of April 4th through the 10th is National Public Health Week, and the theme is Public Health is Where You Are. And whereas Public Health Week celebrates the role of public health in educating and empowering communities to improve health, prevent illness, and increase preparedness for disasters. And whereas COVID-19 response has remained at the forefront of the Lake County Health Services activities since March of 2020, and continues to be the longest disaster response effort in Lake County history to date. The divisions housed under the Health Department are Public Health, First Five, Administration, Environmental Health, and Veterans. And whereas Public Health Division has continued COVID-19 crisis response and successfully coordinated in-home, drive-through, and mass vaccination sites to provide COVID-19 vaccines throughout the community. Additionally, Public Health collaborated with local agencies to further programs working to reduce parental substance use disorders and to provide Narcan kits and training to individuals and groups. Coordinated access to telemedicine with board-certified pediatric specialists, enabling uninterrupted therapy and medical services accessibility during COVID-19 shutdowns. Increased and led educational efforts, distributed oral health products for adults and children, reinvigorated local school gardens, provided tobacco education, quit resources and outreach to partners. And whereas First Five Division is partnership with local agencies developed an eligibility wizard to help families with young children connect with resources and services in the county. First Five also collaborated with several partner agencies to produce Lake Family Magazine, providing parents with positive and practical advice, as well as creating the Parental Mental Health Toolkit to help providers serving women in their perinatal period to screen for perinatal mood and anxiety disorders. Whereas Environmental Health Division worked to build program capacity to detect, prevent, and control environmental health hazards by increasing staffing and response levels. Response efforts included performing over 343 retail food inspections of facilities, addressing 54 complaints of restaurant code violations, and working with tribal partners on mitigating cyanobacteria, harmful algae blooms. In addition, Environmental Health worked in collaboration with Lake County Public Works to identify methods for compliance with SB 1383, Edible Foods Recovery Program. While keeping up with the requirements of day-to-day operations, Environmental Health continued with providing emergency response support to address the 53 cache fire household hazardous waste inspections and 12 lightning fire complete property debris removal. And whereas Administration Division performed essential organizational and employee support vital to maintaining congruent and accountable operations, despite undergoing significant administrative changes to the included new leadership transitioning, the Administration Division preserved continuing to ensure all state and CDPH compliance standards. The purchasing and billing procedures were followed. In addition, the Administration Division worked with CDPH to secure an additional $1.4 million, in which a portion of the funds was earmarked to purchase a medical mobile clinic to increase access to direct vaccination services for homeland residents or homebound residents. The support provided and enabled the Health Services Department core programs and COVID crisis response team to operate in compliance and at capacity. Whereas the Veterans Division served our local veterans by reaching out directly with more than 6,500 phone calls and more than 3,500 emails. The division helped local veterans to access over $3.5 million in retroactive benefits. Veterans have also worked tirelessly to provide access to health benefits, including COVID testing and vaccination services to all local veteran populations. Whereas Public Health Week also recognized the partnership and service of local public and private health agencies, community partners, volunteers, foundations, academia, and health-related enterprises that are working in collaboration to promote healthy behaviors and support the department of the local COVID-19 crisis response activities. Now, therefore, be it resolved that the County of Lake Board of Supervisors, along with the Lake County Health Services Department, do hereby proclaim the week of April 4th through the 10th, 2022 as Public Health Week in Lake County and urge all residents to join in this important observance. Passed and adopted on the 5th day of April 2022 and signed by the Chair of the Board of Supervisors. All right. There you go. We'll go ahead and turn the mic over to you.
So I have about a half hour?
Yeah, half hour.
Okay. Thank you, Supervisor, for sharing with community, the room, the board, our accomplishments in our public health department and service to the community. As some of you saw online with child abuse awareness, there was a lot of folks, 20 plus, I'd imagine. I think that's a testament to what our community is, what it represents, and that's collaboration, togetherness for the betterment of those that we serve. Public health doesn't work in a silo. It takes all of us. So this proclamation could have been at least 20 pages. Several people were left out. Behavioral health, social services, the fire department, sheriff's department, police department, Sutter, Adventist, Elijah, Tribal, the list could go on, CVS, Safeway, right? They all played a pivotal role in helping us navigate through the pandemic to provide essential services and support to the community. I think one of the most important aspects that gets left out in praise when it comes to public health is the community, the people watching online. If it wasn't for you and your efforts and your attention, your advocacy, and your willingness to show up, we wouldn't have all these glow and grows to share in this proclamation. And again, that speaks a testament to this community, to the staff at the Public Health Department. You have survived trial and tribulation over and over and over again, and you still show up every day to serve heartlessly, fearlessly, and with absolute commitment. And it doesn't go unnoticed on me, and I really hope it doesn't go unnoticed on the community partners and the community as a whole. I'm humbled to be here, and I'm humbled to be receiving this proclamation on behalf of the department. I'm honored to serve, and I just want to thank the community, those watching, those in this room, and for your tireless effort in supporting the health department. And I look forward to the bright future in collaboration and partnership as we continue to move forward to address health disparities. Just because COVID-19 is dwindling off and we're in the green tier, that doesn't mean we let up now. We start to prepare for the next one. We start to look at environmental issues when it comes to drought, when it comes to malnutrition, child abuse, neglect, behavioral health issues, transportation, IFT, ALS, VLS. It doesn't stop, right? But I appreciate the space, the attention, and the time that the community, the board, and other organizations are giving us to catch up, because oftentimes in public health, that's what we're doing, is we're trying to catch up. So thank you for reading this and sharing our glows, and again, appreciation to the staff and the community for your attention to the matter. Thank you.